A very good evening to all of you here today. So welcome to yet another session of D-Life podcast. And I'm the host for this evening. I'm Pramila Mundra, a registered nutritionist based out of Bangalore. And I'm also additional low carb nutrition. I did my low carb nutrition degree from D-Life Academy. And I'm also a member of Nutrition Network. So before I introduce our special guest for today's session, I would like to say a few words about D-Life community. So D-Life is the first keto and low carb community of India. It was founded in 2014 by Anup Singh, an engineer from IIT Roorkee. Apart from being a very active keto and low carb community, D-Life also offers amazing diploma programs in nutrition for anybody who would like to take up this field. Now, without any further delay, I would love to introduce the guest for today, Dr. Andrea Salcedo from US. So she's specially taken the pain to connect with us this evening, India time, to have a wonderful session with us. Welcome, Dr. Andrea.
Hi, this is Dr. Andrea Salcedo, your conscious gynecologist. It's so nice to meet you, and thank you, Pramila, for this opportunity and an honor to speak to you, but also to the worldwide community of D-Life. Thank you.
Yeah, so I would like to say a few words about Dr. Andrea here. She's an obstetrician and gynecologist physician from Loma University. She's earned her master's degree from University of Southern California. She's also got her degree from the University of College of Pacific. And also she's been a certified board in obstetric and gynecology, a board member. She's a wife and mother as well, with almost 20 years of experience in her field. So we are looking forward to discuss a couple of enriching discussions from her experiences. So we would focus a lot on how poor metabolic health can have ill effects on the fertilization or the ovulation process. We also would touch upon how gynecology problems usually happen or are caused by poor metabolic disorders, and how lifestyle and dietary changes can actually play an important or primary role in treating them. So welcome to the session, Doctor.
Thank you, Pramila.
Yeah, we would like to start with endometriosis because we have read about it, the study and the paper you've published. So we would like to know if endometriosis is detectable timely, and are there any specific tests which can detect them?
Yes, endometriosis is such a debilitating disease for women, and it is very challenging to diagnose. Sometimes women are struggling silently for 5, 6, 7, 8 years without even receiving a diagnosis, and they've gone to see so many doctors, OBGYNs also, and they cannot nail down a diagnosis that makes sense, because it is really a constellation of symptoms that develop for women. Oftentimes it is really painful periods. Sometimes people have pain in between the space between their rectum and their vagina, and sometimes they have pain with intercourse, and sometimes they have a lot of bloating or pain when they have a bowel movement. And it can also occur even through, times when women are not on their menstrual cycle, but they can also experience this discomfort, this severe pain in their pelvis at any other times of their cycle, but also most prominently during ovulation. The best way that we can use to diagnose per the textbooks endometriosis is through laparoscopy. So putting a camera into the belly button of a woman to take a look around. And that doesn't always give us a great sense, because sometimes we take biopsies of the linings of the peritoneal cavity and it just shows inflammation, which is very consistent with endometriosis. But if it doesn't show endometriosis cells, many doctors feel very confused and patients feel very discouraged about how to get that diagnosis, but it's much greater than that, as we know. And so that's how you would diagnose it, but it's very much a clinical diagnosis. Sometimes we can see big endometriosis cysts on the ovaries on ultrasound or MRI, but most of the time patients don't have those features on imaging, and which makes it even more challenging to diagnose. So I really do believe that endometriosis is a clinical diagnosis based on several features, instead of looking for imaging or even looking at laparoscopy or surgical diagnosis, which surgical diagnosis is the gold standard.
Okay. So coming to the root causes, can it be in any way prevented because of the lifestyle, or it is normally happening irrespective of the lifestyle or the food habits we have?
I didn't hear you very well, but what I understand is what you asked is does lifestyle play a role in the development? Is that what I heard?
Yes.
Okay, very good. So particularly endometriosis has had many different theories of how it develops, which also makes it very challenging on us doctors to diagnose, because for so long we haven't really understood how it develops. But there are two main themes that we must understand with endometriosis. And so endometriosis occurs when the lining of the uterus escapes into the pelvic cavity, and it'll implant on various areas of the pelvic cavity or even the entire abdominal cavity. And then those endometrial cells, the cells of the lining of the uterus, are also affected by hormone changes that contribute to menstruation. And so just as if the lining of the uterus will shed, through the uterus and out of the vagina, but also through the fallopian tubes, called retrograde menstruation. So what normally every woman who has a uterus and is menstruating, their bleeding will come out from the vagina, from the uterus, but also from the fallopian tubes and exit into the pelvic cavity. That's normal. But what happens with endometriosis is that there is some sort of inflammatory process that allows the lining of the uterus that escapes through the fallopian tubes to stick to the pelvic cavity, and it starts to revascularize and regenerate a new blood supply that allows it to receive the hormonal signals of menstruation. Now, why is it that only 10% of people have this? Well, what we're starting to notice is that this is a gut microbiome destabilization disorder, which really takes the point of view of endometriosis to a greater view. Because if our intestines, particularly our small intestines, have inflammation from disruption of the gut microbiome, the inflammation from that disruption will leak through, and actually through gravity fall into the posterior pelvic cavity, and allow that inflammation will cause the endometriosis cells to stick and then cause their problems. Those cells that stick will eventually, your immune system will try to process them, to remove them. And that process is also very, very painful. And so not only the bleeding episode that women have from their menstrual cycle becomes very painful because those implants are in places where they shouldn't be, but then your body tries to process them. And that is also very painful and leads to tremendous amount of scarring. So while it's helpful to give women certain medications in gynecology, like birth control and things to help hormones to stabilize the lining of the uterus, that's not the root of the problem, okay? The root of the problem is the intestinal dysregulation that occurs. And as we know, in low-carb communities, we know that intestinal dysregulation comes from oftentimes hyperinsulinemia, eating processed food, hyperglycemia, that leads to that damage of our intestine and also our microbiome that leads to these problems. So that's why oftentimes when women have had treatment with hormones, it doesn't fix it completely because we haven't hit the root of the problem.
So does that mean a ketogenic or a low carb diet can actually help here?
Yes, so unfortunately, there is not a cure for endometriosis. And so it is a chronic disease, much like any other inflammatory disease that humans deal with. I liken it very much to a rheumatologic disorder, autoimmune disorders, those kinds of things where we have to decrease inflammation. And so absolutely a low carb, a well-formulated low carb, high, healthy fat diet, ketogenic diet can be very healing to the gut microbiome. And that will help your body's immune system and gut microbiome regenerate and heal and then reduce our inflammation. And absolutely, I've had such success with using low carb, healthy fat diets to help regenerate that lining. And women do have a lot of success. The problem is that so many women, particularly with endometriosis, are struggling with carbohydrate addiction and they don't even know. And so to reduce that sugar is very, very challenging. And for some people, not sustainable. However, you just have to keep teaching them about how that will improve things. And then eventually it does. Little steps, baby steps.
Interesting, really interesting. So this is an extension to what we have been just discussing. The PCOS symptoms, which can be irregular periods or painful periods. So does it also help with a ketogenic diet or a low carb diet when it comes to PCOS? Because there are a lot of young girls and we see more and more women being affected with PCOS conditions. So what could be a way to deal with the intervention of lifestyle and dietary changes here?
Very good question. So PCOS, polycystic ovary syndrome, is a syndrome, and sometimes the features of this syndrome come and go depending on how your genes will express the manifestations. And it really comes down to insulin resistance. And so we don't really know exactly why patients have PCOS and what makes one patient have PCOS versus another. But we do know that the effects of high insulin levels will lead to insulin resistance. And then that insulin resistance will allow your ovaries to increase the testosterone that it makes. And that testosterone directly affects the liver. And the liver produces a special protein called sex hormone binding globulin. And that protein does exactly that. It binds our sex hormones and prevents them from being fully active in our body. It almost stabilizes them. But if there's less sex hormone binding globulin, there's more testosterone floating around. And that actually directly inhibits in our brain a special hormone called gonadotropin releasing hormone. And that impairs the ovulation signals from our brain to our pituitary gland to our ovaries. And so I liken very much PCOS as a hormone destabilization disorder, but not the hormone you think, not with the women's hormones, not LH and FSH and gonadotropin even. It's really the hormone insulin. And if a woman's body is under any sort of stress at all, it raises insulin levels. And this is hard for a gynecologist, a woman, to say, but women inherently, our biology was to help procreate, to have babies, okay? But our body and our brain is very smart. And if we are noticing anything, whether our mental capacity realizes it or not, that is going to destabilize or threaten the biologic investment that it takes to procreate, to have a baby, it's going to shut that cycle down because of the elevation in insulin. It's a protective strategy almost. And so if there is too much insulin circulating in our body for various reasons, and it's not only just from too much carbohydrates, but sometimes it's stress, or, low vitamins, or all kinds of things, hypertension, anything that raises insulin level will, and as a protective mechanism, stop our ovulation, stop our cycle, because insulin has allowed it to do so, because it's not a good time to get pregnant. And so if you're too stressed out for many reasons, it's not a good time to have a baby. And so your body will protect that. And so if it stops your cycle, stops the ovulation, your period will also stop, right? And you will not have a menstruation until that goes away. And so many women know this inherently, because if they've ever had a very stressful time in their life, a death in the family, going through final examinations for a degree, anything, oftentimes people will skip their period. And we know this, right? If we're not pregnant, we're like, oh, okay, well, it's probably because I had something really stressful going on. But after a long amount of time, that chronic exposure to testosterone will actually cause features that are really unhealthy. It will cause hair loss in the male pattern features. It'll cause acne in places that we don't want it, or, skin tags on our neck, even skin changes on the back of our arms. And so all of those things are really difficult for women, but also not just cosmetically, but also because those elevated testosterone levels will increase our risk for cardiovascular disease because of the hyperinsulinemic response. And so we know that some women with PCOS will turn into more of an obese phenotypic expression, and some women will have a more thin expression of PCOS, both equally concerning. It just depends on how a person's biology will dictate their expression.
Right. So it does somehow establish that if we control the intake of carbohydrates, it will help with the, becoming more insulin sensitive, and thereby the balancing of hormones.
Absolutely. Absolutely. And it is one of the things that we as doctors recommend to patients who are starting to show features of PCOS is lifestyle strategies, but we have never been so focused than before now, because we are teaching women, well, what raises insulin level? What is it that we can modify that raises insulin? Carbohydrates, absolutely. And so if we reduce our carbohydrates, sometimes that's all we need to do, and women's cycles go back to normal. We know that women and humans really only need 4 grams of carbohydrates to live a sustainable life in their body, and we don't need to take that in. That comes from our liver. Our liver can actually create those carbohydrates that we need. So we really don't need to take in any. And so if you bring it into that frame of, wow, you really don't need this to live, your liver will take care of it for you, then the intake of carbohydrates is moot. We just don't need it. But in our cultures, and particularly me, I come from Mexican ancestry. We eat lots of rice and beans, and that, just 1 cup of beans has about 44 grams of carbohydrates, or 1 cup of white rice, same thing. And that's way too much. That's way more than what our biology can handle. And some people, that's all it takes. It rises the insulin level for long periods of time, and chronically, after weeks and months and years of that kind of lifestyle, insulin resistance has occurred and will definitely impact not only our fertility, but the stages of gynecologic disease that occur after that.
Yes. And it's interesting how you mentioned beans having a good amount of carbohydrates, because in India also, I think the staple diet is usually roti, which is the wheat bread, rice and beans and lentils. And most of the people have or think beans and lentils as the major source of protein.
Yes.
So
And that's very
interesting.
unfortunate. It's very
Yes.
difficult because our body can only take in a certain percentage of protein that's in beans, and after that, it's not very helpful. And so that's really hard for that message to become conveyed and accepted by our communities, because that is the vegetarian diet, that is plant-based diet. And it's not like our people are really eating lots of processed food all the time. You know, we know what foods to avoid. We know to avoid sugary sodas and sweets. We know that. But we have to remember that even things like beans, whole grains, rice, lentils are extremely, sensitive for us. As people of color in this world, we do know that people of color actually receive the impacts of starches way more than our Caucasian counterparts. And that's why so many of the people that in our communities struggle with diabetes, hypertension. It's not like we're eating terribly all the time. It's just that sometimes it might not be the right diet for our phenotype. So.
Yes, as you rightly said, probably it's the awareness. It's not that people are intentionally trying to have a diet deficit in protein or rich in carbohydrates, but probably they are unaware or less educated about what would be the right kind of source of proteins. And for vegetarians, we largely depend on lentils and beans.
Yes, I understand. That's very hard. Because there's so many factors, cultural factors, community factors, to tell family members or to break the change of what food looks like and how to sustain ourselves has so many layers. It's not just, change your diet. There's so many layers to that, and religious layers and ethical layers. And so you just teach people, the information, and then they get to decide how they're going to handle it. But, even among vegetarians who rely on lentils and beans, there are still areas where we can improve just other simple carbohydrates as well. So.
True. We would also like to discuss about perimenopausal or premenopausal syndrome, which is again a very major phase for most of the women who are facing either symptoms of fatigue, severe depression, weight gain. And I think a lot of women live with the fact that this is going to happen. It's a perimenopausal or premenopausal phase, and you will gain weight or you will go through these symptoms, and they accept it, not knowing that there can be a better way to avoid these symptoms or probably go through this phase in a better way. So could you shed some light on this phase of hormonal change?
Yes, it's something I'm really excited about because it's coming for me too. and so we understand, and it's something that women also try. I think many in my circle, we don't want to think about and talk about, and because it really does impact on how our point of view of how we look at ourselves as women, and we're not as youthful anymore as we thought we were. And so, but what we do know is that insulin resistance and women who struggle with chronic medical disease have more struggles with perimenopause, and the symptoms, what we call vasomotor symptoms, which is, hot flashes and night sweats, and but also other symptoms of, vaginal dryness and decreased libido, but also weight gain. And so what happens is when we go through the perimenopause transition is that the declining estrogen levels from less ovulatory cycles will actually change the receptors in our adipose tissue from our hips and gluteal area to our abdomen, to our visceral adiposity. And that change happens because of the decline in estrogen. That's physiologic, that is going to happen. However, when there is declining estrogen level, and if we already have problems with visceral adiposity, we're going to increase that visceral adiposity. And that visceral adiposity is way more inflammatory and leads to much more insulin resistance than any other type of of fatty tissue. And so when ladies go through that, then and then now go through menopause, their risk of cardiovascular disease equals that of a man, which is much higher than what women were having before they went to menopause. And so some of the best things that women can do in the perimenopausal state is to reduce carbohydrates, reduce insulin resistance, because we know that that you don't have to have these terrible symptoms. They will go. We know many cultures who have much low levels of insulin resistance have almost no problems with going through the menopause transition. They have no of the unwanted side effects. And so, hot flashes and weight gain, because their diet is very limited in carbohydrates. And so truly the goal is to reduce sugar, reduce carbohydrates, so that we can reduce our visceral adiposity that causes so much inflammation that leads to these changes, of the unwanted changes of perimenopause.
Wonderful. I think it's very informative to all the women who are listening here. I would also like to know, are there any supplements which would specifically help during these phase?
Yeah, there's a lot of different herbal formulations out there, and I don't really have one that I, highly recommend versus the other. But I do know that acupuncture is very, very helpful during this transition and reducing hot flashes. And I don't have a lot of good information about how that works because I'm not a Chinese medicine specialist, but we do know that there's a lot of data that supports women who go through menopause to reduce their vasomotor symptoms using acupuncture. Acupuncture helps a lot. And so that is definitely something that I offer and refer patients to. Acupuncture, just a low carb lifestyle, a multivitamin. Omega-3s are very, very helpful with reducing inflammation that leads to all of these disorders that we've talked about. Vitamin D, of course, and magnesium, all those things are very, very helpful anti-inflammatories that we use, and they're very potent, they're very powerful. And so we use them all the time through these chronic medical problems that happen and affect women. But yeah, there are lots of herbs, but honestly, I don't know exactly how much to give to people. Some people they work, some people they don't work. But really what does work is reducing carbohydrates so that you'll have less of that inflammatory disorder that leads to all of these problems of vasomotor symptoms of menopause.
Wonderful. So I think the root issue is probably the excessive consumption of carbohydrate, which actually causes the hyperinsulinemia.
Yes, it is a big player. Yes.
Wonderful. We would also like to know, how close is insulin resistance linked to fertility and fertility parameters? Because there are a lot of women who want to conceive and they do face issue when they want to conceive.
You cut out a little bit, but it sounds like, how does insulin play a role in fertility? Is that right?
Fertility, yes.
Yes. Okay. So yes, for the reasons that we have discussed before, is that high insulin levels will actually lead to the changes in our brain that will reduce our ovulations. Okay. So when we talk about fertility, there are two important things that we talk about, even entirely within the field of gynecology, which is high insulin levels and high inflammation levels. Okay. And so even if your periods are regular and your insulin level hasn't affected the cycle of your period, the other player that we need to talk about is inflammation. Okay. And so chronic low-grade inflammation from various medical problems, it could be smoking, it could be poor sleep, it could be hypertension, it could be low vitamins, it could be trauma, it could be depression, anxiety, all of these things that raise inflammation actually damage the blood vessels that lead to every single organ in your body. And so how is it that it affects your ovulation and your fertility? Well, the blood vessels, even the blood vessels that are being fed to the lining of the uterus, even the blood vessels that feed the ovaries, and that little blood vessel that feeds the ovulatory oocyte that gets ready for ovulation, even that blood vessel gets affected. So every single blood vessel receives the damaging effects of hyperglycemia, but also inflammatory markers that damage blood vessels and lead to difficulties with the functioning from the structure of those gynecologic organs. And so even though a woman may have regular periods, the blood vessels from what we just talked about right now could actually be damaged. And so if the blood vessels are damaged, the organ will not function properly. And so that is so discouraging for women, because they oftentimes think, well, I have regular periods, my insulin level is normal, but it's not that simple, because we know also that painful periods or heavy periods are also can be the result of inflammation at the lining of the uterus. And if the lining of the uterus is inflamed, then if the conceptus comes to implant, whether it's through in vitro fertilization or through natural fertilization, if that inflammation is present, the conceptus will not implant properly and cause a miscarriage. Or if it actually does implant properly, it can lead to other obstetric complications like growth restriction or high blood pressure in pregnancy. And so we know all of those obstetric complications do stem from pathologic neovascularization, pathologic angiogenesis, growth of blood vessels from that initial implantation episode. And so we do know that even women who have PCOS, but maybe regular periods, or their thinner phenotypic expression of PCOS and end up going through infertility, are actually some of the more difficult infertility patients because of that chronic low-grade inflammation that they present and they have. And so it's not so simple as just, is your insulin level normal? But other people express it as those inflammatory molecules that do damage their blood vessels as a whole.
So I understand that apart from high insulin levels, inflammation is one common cause across for most of the issues.
Yes.
So would you recommend a couple of few impactful changes to reduce inflammation?
Yes. So it really just depends on what your inflammatory triggers are. So if some of the easy things that we can kind of look at that are, sounds like, oh, if you have this cause, we can just remove it, is smoking. So smoking anything, smoking, tobacco, smoking anything that introduces toxins into your bloodstream through your lungs will definitely cause that. Sometimes other things that cause inflammation are certain types of food like gluten or lectin or nightshade vegetables, or lactose, and there's a lot of lactose intolerance for some people, and that can lead to inflammation in our intestines and circulate inflammatory molecules all over. And so lectin's very interesting, particularly nightshade vegetables. So anything like the skin on certain fruits and vegetables, particularly like the little capsule on lentils and beans, can sometimes be very inflammatory for some people. So not only does it cause hyperinsulinemia for some folks, but it can also cause inflammation from the toxins within the skin, which is called lectin. We also see that poor sleep. So if you're not getting enough sleep, or if you're not getting continuous sleep and you have you're snoring, that will actually raise inflammation as well and lead to that. And we also know that diabetes, of course, and then anxiety and depression, and ever have a history of some sort of significant life trauma can all really raise your inflammation. So bringing them up to the table, going to counseling, reducing certain inflammatory diet substances that people might be taking in are very, very helpful. So much of this has to do with mental health as well. And so having good counseling and therapy is very, very important, which is also challenging for certain communities. I know that in my heritage, it's very hard to go and seek counseling and stuff. But when patients have these problems and they're going through anxiety and depression, we know that those things raise inflammation. They raise inflammatory markers because your body is under constant stress. And stress is very, very powerful. And it doesn't have to do with that maybe you're not strong enough to manage something. It has nothing to do with that. But your body truly feels that it's under attack. So the immune system is going to activate and try to be available to attack anything that might be causing problems. But if chronically it's elevated, those damaging effects of the inflammation related to your immune system really does impair your vasculature, which impairs your fertility.
So do you think physical activity or some sort of exercise also could help here?
It can. It's not the big thing, but if it makes you feel good, then yes. Remember the calories in, calories out model is not something that is very helpful to our biology, and our bodies are way more complex than that. But muscle mass, increasing muscle mass as a repository for glucose so that it's stored appropriately is very, very helpful, and it helps reduce insulin resistance as well. And it just makes people feel good if they like it. And so it's not something that I always tell patients that it's the number one thing that they do. And in fact, they're always laughing because at the end of my discussions with patients, I always comment that I'm like, did you notice I didn't talk about exercise? And, it's very, very helpful, but sometimes people are too busy, or, it's just not something that they like to do. But there's all kinds of little easy things that we can do to increase our muscle mass that definitely helps things. So.
Yeah, probably strength training helps here, and
Absolutely.
hiking up the protein intake.
Absolutely.
Yeah. So I also understand that you also had started your low carb journey as you, faced some issues. So we would like to know, how did you start your journey and what made you continue it? And what are the benefits you have personally seen by taking up the low carb journey?
Yes, thank you, Pramila. That is such a good question. When us scientists and physicians, we can get we can preach a lot about what to do, but until you've heard our own story, then sometimes it just doesn't make sense. And so, yes, absolutely. So many of us in this low carb space have had personal experience with chronic metabolic disease then, where we were looking towards the routine standard of care, and that didn't help. And particularly for me, it started out when I was a younger doctor and trying to conceive my second child. And I was having really a big difficulty with trying to have a baby. My periods were every month, but so I knew it wasn't insulin resistance necessarily, but I was so stressed out with my job. I was working a really difficult practice, and after a year and a half of trying to have a baby, I just couldn't. And I gotten pregnant so easily with my first son, and I couldn't understand why. Well, and then I realized that maybe it was my job and it was just too much for me and my physical body to handle. And so when I quit my job, I was able to get pregnant like that month.
Wow, interesting.
And then, unfortunately I had a miscarriage, and I think it had to do with just still my body recovering. And I didn't even have another period. I got pregnant right the next cycle after that. And that's my second son. And so that piece is very important. But what's also important to know is that through that time, I was also struggling with endometriosis. And when I had endometriosis, I had a large 9-centimeter ovarian mass with it was a blood-filled cyst called an endometrioma. And I didn't really know. I just felt a lot of pelvic pressure and fullness. But when I ended up having an ultrasound done, they found this big ovarian endometrioma, and I had to have it removed, and which was fine because it was pretty big. But then as gynecologists, we tell patients, please, take birth control so that we can reduce the incidence of there being a recurrence. And to me, that just didn't make sense because I wanted to have more children. And so how do you take birth control and to suppress the damaging effects of endometriosis? But then if you want to have kids, it just doesn't make sense. And I couldn't believe it. And I finally felt the depression and despair that so many of my patients were feeling when they were going through endometriosis, but wanted to have children. And so I was like, wow, I have to be able to do better. We have to do better than this. There has to be better options. And so I really started looking at the intricacies of the development of endometriosis and understanding all of the things that I was sharing. And so everything that I have been preaching and educating the community on are things that I've done myself, and to really reduce the inflammation. And so, I've not had to be on any kind of hormonal methods to improve my endometriosis. I started a kind of at that point a gluten-free diet because that was kind of what was reducing my inflammation at that time. And then when I had my third child, I had gestational diabetes and I had a really hugely elevated glucose test. And no one in my practice could understand why. I was 120 pounds and very active and eating well. But my body type could not handle the amount of grains that I was going through. And so learning about the the gestational diabetes diet and how they recommend at least 30 grams of carbohydrates per meal, I couldn't handle it. I was going to have to be on insulin if I have kept up that many carbohydrates. And so I grew really frustrated about the standard of care because I couldn't believe that if I was taking in carbohydrates and I was going to need another medicine to help balance that didn't make sense. And so I really took a deep dive into the literature and the resources that were out there to, figure it out. And then I fell onto the nutrition network. And once I understood that, man, insulin resistance really does play a role in so many problems, then it just took off. And so that was about 6 years ago. And, my career has been entirely purposeful and satisfying because I'm really able to treat the root cause of medical problems. And so for my endometriosis personally, I have not had any problems with it. I used to have very painful, heavy periods, but after, many, months and years of really being on a strict low carb diet, I have had very little problems with my endometriosis. And the great thing, and I think that we need to acknowledge is a woman's menstrual cycle truly is a vital sign. It truly does teach women about what's going on in their life. And so for me, I know that if my period becomes heavy or painful, then I'm like, what happened this last month? What did I do? What exposures were happening to me? Is my life out of balance? And then I make modifications based on that. So it is incredibly helpful. I love not being on hormones because I'm really able to be in tune with what is going on with my biology.
Very interesting. I'm sure that it's been helpful for all the viewers here today. So I think diet and stress, I think these are the two key factors which you mentioned that plays a huge role when it comes to balancing of hormones. So I think there are a lot of people waiting to ask questions. So I would like to open the session for Q&A.
Can you share a little more about premenopause? Hey, this is Shilpi. So I just wanted to ask, can you share a little more about premenopause and menopausal symptoms? How long does it go on and how to identify them?
Yes. So thank you, Shilpi, for that question. So perimenopause that transition can last about 10 years. And so, and everybody's a little bit different about when it will start, but we do know that the average age of menopause, which is 1 year of no periods, is age 51. So that being said, these symptoms of perimenopause can start as early as in the early 40s. And a lot of times what women will notice is that the quality of their ovulation may not be as robust. And so many women will notice that their period will begin with some brown spotting that will happen for several days before their menstrual cycle. And that has to do with the quality of the ovulation. That ovulation does not secrete as much progesterone to stabilize the lining of the uterus. And so we get this withdrawal bleed a little bit earlier. And so some people will even miss or skip a cycle every once in a while, and that's okay. You know, as long as your period is not irregular for more than 3 months at a time, that's okay. You're going to have that as we're changing, you know, going through the change of life. But other women will notice a decline in their interest in intimacy. Sometimes they'll notice some skin changes. Their skin will get a little bit drier, more kind of papery. There's lots of little, they'll notice that they'll have less of that adipose tissue around their legs and then more in their midsection. And so, those are all things that will just happen. But it has to do a lot with the quality of your ovulation and the resultant estrogen progesterone that comes from that. So.
Great, thank you.
You're very welcome, Shilpi.
We have another question here from Yogesh. Are there any specific tests which you recommend to identify various inflammatory conditions?
Yes, so that is very challenging. And so because there are so many methods of measuring chronic low-grade inflammation. One of them is C-reactive protein, which comes from the liver, and it's the liver's response to receiving insult, so any inflammatory insult. The problem is that inflammation can go up for many reasons. It can go, that level can go up for active infection. It can go up just from being, a diabetic or having chronic exposure or recent illness. And so it can go up for even something cancerous. So it's extremely nonspecific. And so even though we might see some elevations in C-reactive protein, it is very difficult to interpret the cause of that. And so it's not something that I would recommend testing all the time, because truly just so many of the other markers can teach us that, if you're struggling with, infertility or acne or anything, those clinical markers are way more valuable than measuring a test. So.
Okay.
Can you, hi, my name is Harshil. Can you help on how one can deal with low AMH or maybe low ovarian reserves, basically, and the estrogen progesterone balance through maybe lifestyle and nutrition changes? What would be your view on it?
Thank you. So anti-Mullerian hormone, or AMH, is one of our markers that we use in measuring ovarian reserve. And, of course, as we get through, our life and our fertile years, we have less ovarian reserve, which is biologic and physiologic, but sometimes we're ordering that test in women who should have normal ovarian reserve. And so absolutely, we do see some reductions in ovarian reserve when women are going through chronic low-grade inflammation for the reasons that I was talking about. If the blood vessels that are feeding to the ovaries are damaged, they're not going to have good ovarian reserve. And I have plenty of patients that I treat that where we focus on lifestyle, particularly reduction of carbohydrates, and that number gets better. So so it's kind of helpful. I think we can, get to the point where we look at numbers and we try to treat the number, and that's helpful. But it's really more of the clinical features that are very helpful at that time. But that's just going to be interesting if you check it and someone who should have normal ovarian reserve and it's low. A lot of the times, it has to do with chronic low-grade inflammation that leads to reductions in egg oocyte quality for women who are experiencing infertility.
Thank you.
You're very welcome, Harshal.
There's a question from Poshini.
Yeah. So I just wanted to check in with you and understand the role of thyroid hormone in fertility. especially if it is coming in from, let's say, a Hashimoto condition or just with the elevation? And what would, I mean, yes, we've understood that, reducing the carbohydrates and keeping that insulin levels low, inflammation low, through stress and sleep is important. But is there anything specific when it comes with thyroid? Because it does seem a little more complicated for us to understand.
Yes, thyroid is also one of those glands of environment, and it really does receive the effects of chronic low-grade inflammation, just like any other organ does too. So many of our patients who struggle with infertility or gynecologic disorders also have elevated Hashimoto's antibodies, and that oftentimes goes hand in hand. And then we get focused on, the thyroid, and we think that treating the thyroid is going to make, the ovulatory problems better. And sometimes it does. It absolutely, there is a role. There are problems with, thyroid and also prolactin levels that can lead to irregular periods that, of course, first need to be organically understood and ruled out. But so many of those disorders are also related to insulin, right? And it's so hard because, women come who have struggled with obesity or PCOS, and they've got hyperinsulinemia and, pre-diabetes, also have these thyroid disorders as well. And I hate to just say the same thing over and over again, but it really is a vessel inflammatory problem. And so if, our body feels like it's under stress, of course, it's going to, react in the ways that I've discussed. And so, yeah, and oftentimes just treating those players really does reduce those antibodies, those auto antibodies, right? That lead to these problems. And so there's so much that has to do with your body feeling like it's under attack. Okay. And if your body feels like it's under attack, it's going to activate your immune system to protect and increase those, antibodies that circulate all around. And so we can label it as a thyroid disorder, but truly, it sounds so simple, but oftentimes it is, and that part is also interesting to teach patients about, is how interrelated everything is. And but yes, thank you for your question, Pashni. There are some very specific thyroid disorders that need to be ruled out, absolutely. But once you've ruled them out, oftentimes it is, chronic immune activation that leads to those problems.
Just to follow up on this, can a person look at, not using the thyroid hormone externally with an equivalent diet to support? Is that because most of the time we hear get onto the thyroid hormone, the Thyronorm or erythroxine. I think these are brand names in India, but they get onto the hormone and it doesn't seem to, it seems to be a lifelong intake.
Yes, it can be if we don't get to the root cause of the problem, because truly, if there is less thyroid hormone being secreted by the gland, the organ, you can kind of look at that as the same thing as maybe an ovary not functioning appropriately also, and so a lot of times that has to do with just the receipt of inflammation from whatever exposure it is. And so, yes, if you don't change the initial nidus of the inflammation, then of course you're going to be on lifelong thyroid medicine, and so, and I'm not trying to simplify it too much because there's so many layers, and that's why chronic disease is so hard to treat. But trying to figure out what the inflammatory trigger is really important. So,
thank you so much.
Yeah,
Dr. Andrea, I have a question. Shashi
yes,
here.
Shashi.
How difficult or how easy it is for a young lady having endometriosis to have a baby? Because I have a case. She's type 2 diabetic plus having endometriosis. So, what are the difficulties or challenges?
Yes, thank you. And so, for all the other reasons that we talked about, the inflammation, right, and the inflammation leading to ovaries and the lining of the uterus, but the added problem of endometriosis where the endometrial cells stick to various areas of the pelvic cavity and the body trying to process that that exposure of those endometrial cells and the inflammation of bleeding can cause very disfiguring anatomical changes that lead to difficulties in natural fertilization and conception processes. So if our fallopian tubes are so scarred because of the inflammation from endometriosis, they're not going to receive the ovulation like they should, and they'll be impaired. And so sometimes, like me, I lost my right ovary in that process because, number one, I didn't understand endometriosis as I know it now, but I lost an ovary. And so unfortunately that kind of reduced my fertility a little bit. I was able to have a couple more children after that, but it's likely that I'll probably experience a little bit of an earlier menopause because of that. But yes, the disfiguring effects of the inflammation and the scarring from the stages of endometriosis, absolutely, and I don't have any good data that says that low carb diet improves fertility in the setting of endometriosis because it reduces scarring. To me, that makes sense physiologically, Shashi, but I don't have a study that says I looked with a camera and now the scarring is better. But I do know that the symptoms related to the scarring of inflammation of endometriosis dramatically improved by reduction of carbohydrates anecdotally in my practice. Absolutely. So.
Thank you. Thank you.
You're welcome.
Any more questions? We can take up probably a last one.
Just 5 minutes more.
Yeah, we still have 5 minutes to go.
Just 5 minutes. Yes.
Maybe one last question could be on young girls. What is something as a habit that, parents should be looking at to ensure that their menarche goes healthy and that they don't have any issues? Because we see a trend when they get into professional education, that's when, they're all sorts of PCOD and all these problems crop up at that phase. So what's something that they would need to be mindful of?
Yes, it really is just as simple as, keeping our lifestyle balanced. And so what I mentioned, truly the menstrual cycle is a vital sign. It is a window into metabolic health. And so if a young woman is having debilitating menstrual cycles, heavy periods where they're flooding, they're changing pads, they're having accidents at night where they're staining their bedclothes, that is not normal. And so, we really do need to look at women and help them and try to figure out their inflammatory cause. And so much of it is related to diet, but also stress. And so, we know that there is a lot of pressure on women, to succeed and balance the household and, take care of the family and just be super women all the time, and I'm not saying that women shouldn't try to do it all, but maybe not all at the same time, and because our biology really understands and can sense threat. Absolutely. And so, if a woman is having heavy, painful periods, that you need to take, some sort of acetaminophen or ibuprofen, a non-steroidal, every 4 to 6 hours to handle it. That's not normal. Okay. That is not normal. But we've actually normalized it, right? Oh, you're on your period, you're in your room, in fetal position. That's not normal. And I'm right now in the United States, there's a lot more menstrual products that are on the market, products for heavy periods and super, strength tampons and maxi pads. And this is more and more and more. We're seeing that in society because we do, of course, want to help women be able to function, right? We have to function, but I think that we're treating it with the Band-Aid of, well, here's more, here's a pad that can saturate more of your blood so that you can go and do things, and that's so sad. That is just, we cannot accept that. And that happening more and more, and it has to do with just so much exposure to processed food and carbohydrates, but also the amount of stress that women undertake. Absolutely. So, I really, it's a passion of mine to really help women understand, if your menstrual cycle is heavy and painful, please, please, please look at what your exposures are so that we can help reduce that, because that's not normal.
Thank you.
You're welcome.
Thank you, doctor. So I have one final question, if there are no more. Is it, how far is it advisable to do fasting, extended fasting, while your menstrual cycle is happening?
Yeah, that's a really good question. I don't have any good studies that look at that per se, but I do think that women should have, it's probably not a good time to fast, because you are letting go of a lot of proteins and a lot of electrolytes. And so while I think that, having maybe 2 meals a day during that time is appropriate, please make sure that women are replacing electrolytes during that time, because you are losing electrolytes during the menstrual cycle. And so, it's definitely not a time to, extend your fast or have no food for a couple of days, because it's a time of rest, it's a time of repair, and to give your body the nutrients that it needs. And so to fast during that time, it just doesn't make physiologic sense. So.
Thank you, doctor.
My pleasure.
Yeah. Shashi, shall we end the session, or are there any more?
Yeah, we can end now. It's one hour exactly. Yeah.
Thank you, doctor, once again for taking out the time and sharing your valuable information. And I think there were lots of very valuable and tips which all the women here who have heard today and who is going to hear the session in future, it will be really helpful. So thank you for taking out time and coming on D-Life platform to share your knowledge.
Oh, thank you. It is such an honor. I feel so lucky to have the outlet to share and to really teach my experience. And, I think that we should become storytellers of our experience and teach women, and to not feel threatened or afraid, and to really just speak our truth. And if you found this helpful, I have a YouTube channel called Conscious Gynecologist that talks about a lot of these things in very short spurts. And of course, I've done lots of trainings for the Nutrition Network. And so please feel free, Conscious Gynecologist, and I'm just so happy to be here. Please feel free to reach out to me with any questions. I have an email, consciousgynecology@gmail.com. I'm happy to, help figure out any medical strategy that is helpful to treating people, and particularly women, through their metabolic disease. So thank you so much, Pramila. What a wonderful host you've been.
Thank you, doctor, once again.
Yeah, doctor, thank you. Thanks for accepting our invitation to address the Indian population. And I'm sure more and more people will actually watch the recording in YouTube, and we are going to benefit greatly. Of course, this is a vast subject. Women's health topic is such a vast subject that you can keep on talking for a few days, actually.
Oh, yes.
It's a huge subject.
Yes.
I think 1 hour we are not doing justice in 1 hour, but however, it's a short session and it's an excellent one, considering the time frame and all. So thank you very much. Thanks, Dr. Andrea.
Thank you, Shashi. Thank you.
Thank you.